Substance use disorder is a medical condition that can seriously affect patient care. The stigma associated with substance use disorder can make patients feel judged or labeled. They're also less likely to be honest about their substance use disorder, and they're even less likely to seek help at all. This can lead to worse outcomes, such as untreated withdrawals, overdose, or not even following treatment plans. An example of how a nurse's behavior can negatively affect a patient, if a nurse assumes that a patient is just drug seeking, can delay in the patient receiving the pain medication if the patient is actually in pain. The patient can also, because of this, the patient can end up suffering unnecessarily and lose trust within the medical providers and healthcare system and think that they won't receive the care that they need. As a future nurse, I plan to reduce stigma so that I am more aware of my own biases and that I treat every patient with respect. By understanding and focusing on substance use disorder and understanding that it is a medical condition and not a lapse in morals, I can become a better nurse by listening to my patients and advocating for them instead of making assumptions. The following statements used, such as drug addict, frequent flyer, and they're just drug seeking, puts the condition first rather than the person. To reword these to put the person first, for drug addict, I would replace that with a patient suffering from substance use disorder. Instead of using the words frequent flyer, I would say a patient who has frequently visited the healthcare system and uses healthcare services. Instead of saying they're just drug seeking, I would say the patient is reporting pain and is requesting medication for their pain. Revising the language this way, again, puts the person first over the condition and avoids labeling them or blaming them, and keeps things respectful and professional. Making sure that I avoid language like this can also improve my patient's trust in me. They will feel respected and not judged. They're more likely to open up, be honest, and engage in their treatment plan and might actually follow through with their treatment plan, which leads to a better outcome overall. Nurses can also suffer from substance use disorder, and there are many risk factors. 2 different risk factors can be high stress levels and workplace injuries. Nursing is a professional field that is very emotionally and physically exhausting, and that can make more people vulnerable and more stressed out. Because of this, they might seek out substances to help with their stress and anxiety, to put them at a more calm state. Also, patients can intentionally or unintentionally cause harm to the nurses when the nurses are caring for patients, leading to workplace injuries, such as when a nurse might try to help lift or shift a patient in bed. They might strain their back. Because of this, they might go to the doctor, get a prescription for medication, become addicted to said medication, which then leads to the substance use disorder. Nurses often find it difficult to seek help because they might be worried about losing their license, being judged for having a substance use disorder, being deemed untrustworthy when it comes to patient medications, and they might fear what kind of damage might affect their career. Also, there is a culture in healthcare that nurses often need to tough it out and become a stronger person and not talk about what's bothering them. So this can also lead them to not look for resources for help, especially when it comes to stress and anxiety and within nursing. Healthcare systems or even a colleague could take the time to create supportive environments to help support nurses, such as offering support programs, encouraging open conversations, recognizing signs and symptoms early of possible substance use disorder. A colleague can also step in by checking on them and trying to engage in the therapeutic and open and honest communication with them to try to help them rather than ignoring the issue. One bias or assumption that I could have held in the past when it comes to patient care is patients who watch the clock or appear to be drug seeking. Um, the, the terms that I might have used in the past with these specific patients, I now recognize are untrue and also unprofessional. Learning more about substance use disorder also has helped me come to a better understanding of what is involved within substance use disorders, and that there are many factors involved in substance use disorders, such as mental health, trauma, access to resources, or even patients who deal with lots of pain and are used to taking pain medication, so they build up a dependence upon them. One thing I can do differently as a future nurse is understand that patients who are requesting pain meds are in pain and that pain is subjective. I will listen to my patients and advocate for them so that they get the treatment that they need. And I will approach these patients with more empathy instead of judgment, so that they can get the care that they need when it comes to treating the substance use disorder. In the past, I have treated patients who have chronic conditions that lead to a lot of pain, such as fibromyalgia or chronic back pain. And I know that I have taken the time to write down what time their next pain medications are due when it's PRN scheduled, and I have waited for the patient to ask for them or educated them that they need to ask for them. And one thing I can do is ask them if they want it when it's available. Also, I know that I've had patients in the past who have requested pain meds as soon as possible for chronic pain conditions, and I have prioritized other patients in more acute problems, and did not get back to those patients as fast as I could have when it comes to pain meds. So in the future, I will definitely work at making sure that they get their pain meds on time and in a more timely manner. This will also help encourage the patient to place more trust in me and know that the healthcare system isn't failing them.